So I was in the woods and I climbed up in a ladder stand, and I was climbing back down with one hand, which you're not supposed to do when you're on a ladder. So when I started falling backwards, I didn't want to land on my gun, so I jumped over to the right. And that's how I landed and put the pressure on it, and then the bone shot out this way. And this was 2 days before Christmas. And so when he saw me at the emergency room, I told him to, don't worry about it, doc, just put a cast on it, it's Christmas. But then he also referred me for trauma specialty. Spent almost 2 years with them, and the final with that doctor was, he looked at it and he just shook his head looking at the x-ray, and he said, I just need to go back in. I don't know. And I just said, I can't just let you go back in. I can't deal with this anymore. And he said, well, then would you want me to cut it off? And I was like, I'm to that point. I was running out of patience.
So the first time I met Mr. Riis, he had come in several months after a very complicated ankle injury that required several previous operations. At this point, he had been dealing with greater than a year's worth of pain, actually came in requesting a below-knee amputation.
He said, I understand you want to cut it off. And I was like, yes. And he said, and he looked at it, and he just drew his little finger on my ankle like that, and he goes, I can fix it. He's a miracle worker, no kidding. I mean, I was one sad fella to want to cut his leg off. It's severe pain is what it is, and I had it, and it was always there, wouldn't go away.
Felt like we had the opportunity to salvage his ankle and his foot, and so after having several discussions, we decided to perform a reconstructive operation.
Working with Dr. McKean and just his methodic way he would talk to me and my wife, his concern for me understanding why I had to do things was the biggest for me, and I was just totally confident. Once Dr. McKean fixed me, everything's been pretty much back to normal. Quality of my life is so much better. It's allowed me to do pretty much everything. You know, after people watch somebody on crutches for 2 years, everywhere I go, they're like, wow, you look great. You know, I'm back fishing, I'm back hunting. The fact that I can walk, normal. I don't have a limp at all. Whatever happens, I want it done here at the Orthopedic group because I trust them.